All right, so in this video, I'm going to talk about some different types of health insurance plans. So these are sort of within the context of like the group plans, for instance. So you could be working for an employer and have access to a group plan. And within the group plan, you may even get to choose from some of these different options. Okay. So some different types of health insurance plans. We can have indemnity health insurance. And this is basically more of a fee for service kind of health insurance, where they don't really limit you to a specific network of healthcare providers or things like that. And it's basically the idea that, in effect, you go to certain service providers, and your insurance company basically pays the specified amount and so forth. So you don't really have to be limited to a specific network typically. And you have a lot more choice typically, and basically they're paying more related to what your expenses, they're just paying relative to what your expenses are. Because of all this flexibility, typically the premiums which you're paying to buy the policy are going to be a bit more expensive. There are also managed care health insurance plans. So this is where you have like an HMO, a PPO, POS, things like that. So let's talk about HMO. The HMO stands for Health Maintenance Organization. And within an HMO, they can be structured a couple different ways. So you can have either a staff practice, group practice, or independent physicians contracts. Let's talk about each of those. So the idea behind an HMO is basically you have this organization, the insurance organization, and they are sort of trying to manage your care in some way, shape, or form in order to kind of keep costs under control. So with that in mind, a staff practice HMO would be one in which the HMO actually basically pays for its own physicians. It has its own staff practice. Um, I apologize if you can hear kiddos in the background there. I don't know if you can or not, but um, you could also have a group practice situation. And for a group practice situation within an HMO, that's when the HMO actually contracts with a group of physicians to provide care. And so the physicians groups are sort of their own entities, but they've contracted with the HMO to provide care. So you could have maybe a medical building with a whole group of physicians in it that are part of their own group practice, and then they have agreed to provide care to the participants of the HMO. But they aren't owned by the HMO. They are not employees of the HMO. They've just essentially contracted with the HMO that as a group, they provide services. Another way the HMO can work is through independent physicians contracts. And this is when a physician is not employed by the HMO, but they sign a contract with the HMO that they will provide services to whichever HMO participants come to see them. And so in that case, basically they are paid essentially a flat fee. And if a lot of people come to see them, then a lot of people come to see them. And if not, then they don't. And so it's basically just a contract in which they are agreeing to see whichever people will come from the HMO. So that's kind of the idea behind a health maintenance organization and kind of how it works. So basically, you're going to be limited to sort of a group of physicians typically. It's sometimes possible to get to out of network, but generally speaking, when you think HMO, the idea is there's going to be a limited list of people that you can see and receive health services from for the HMO for the most part. Then we get to the preferred provider organization, or PPO. So for the preferred provider organization, or PPO, basically what's going to happen there is you're going to have a more flexibility, probably more cost, as the buyer of the insurance. And basically what's going to happen here is one in which basically you're going to have preferred providers, or in other words, like in-network providers, and you are basically sort of strongly encouraged to go to those. If you go out of network, so in other words, you go to providers who are not in the network, typically you will have higher deductibles, higher co-pays or co-insurance. The out-of-pocket limits may not apply, things like that. Okay. Or at least they may not apply as much. So basically, with the preferred provider organization, you have sort of preferred physicians and healthcare providers that generally are going to involve lower deductibles for you, lower coinsurance rates and things like that. But then you have the out-of-network providers that are available, and the insurance company will still pay for some of it, but it's typically going to come at a higher cost. So you get a little bit more flexibility, but a bit of a higher cost. Then you have the point of service plans, or POS plans. And the idea there is you have sort of in-network and out-of-network, but the way they run it's a little bit different. And so what it kind of focuses on is you have probably some basically primary care physicians that are sort of in-network, and that becomes sort of your point of service. So you go to your primary care physician as sort of your point of service. And from there, you can be referred basically to other services as necessary, either in network or out of network. And so it's kind of your main point of service is sort of in network with the physician, your primary care physician. But then after that, it kind of depends on who you get referred to and things like that. So that again is that's viewed as sort of being a kind of a hybrid of the indemnity health insurance, where it was typically not limited to a network, and the managed care, which typically is. So you've got a little bit of both. So a little bit of in-network, but also you kind of have some limits, or you have some flexibility to go out of network where it's not really limited to a network. So it's kind of a hybrid plan there, but it's typically going to cost a little bit more because of the flexibility typically. Then you also have exclusive provider organizations. So an exclusive provider organization, that is one in which it's a managed care health insurance, but it only covers in-network services, and that's it. So if you go out of network, they aren't paying. So in that case, that's probably would have somewhat lower costs in some respects, but also basically zero flexibility. So that would be something you want to be real careful about, whether you want to go into that at all if you had a choice, because you're very limited. And if you wind up out of the network, it's going to get very expensive very fast. All right, hopefully this video has been helpful. Thank you so much for watching, and have a great day.